Voila, Pisces, she want to touch my fats.
Okay, you inhale, exhale. Yeah, have lo. You feel?
How many?
About 1.5 fingers.
Small
You try.
lah. You very small.
You try. You inhale. You try to lift it higher. Inhale. Exhale. A bit only. About 1 finger, 1.5.
Okay.
Does it matter your size? Because she's small, so that's why it's small.
Normally 1.5 finger or less than that is normal, after birth. It's normal
Esther
after
confirm
birth.
15 fingers. Hey. Hey guys, welcome back to part 2 of this episode where we're going to discuss postnatal treatments. And in part 2, we actually invited a professional. Her name is Hazel from Mumsrelle. If you guys don't know what Mumsrelle is, it's actually a slimming and wellness center at Orchardgateway, offering effective and non-invasive treatments for mothers and women of all ages. But I think the first question we have for you is like, what's special about like postnatal treatments versus regular treatments?
Okay, basically our treatments, right, actually focus on enhancing overall woman wellness, but we actually specialize in postpartum slimming as well. Okay, so actually such as like tummy or womb revitalizations. Okay, then in general we actually provide like a non-invasive treatments for all mothers and for all women.
Okay, what are some like treatments?
Like, which are your popular treatments?
One of the popular treatment is like our tummy and womb revitalizations, and then we do have the home and pelvic restoration as well. So that can actually help the mothers to actually to work back and then to slim down and then to get their pelvic and then get so-called get back in shape.
So it's like a wrapping, is it? Or what is it?
We actually use machines, and then if they have like this abdominal separations, right, which is called the rectus abdominis, okay, so we can actually help to so-called to close like the gap as well.
See.
And then to get back in shapes, like if they have like any misalignment, so we can actually help them to work it out for them to get back in a better contour shape.
So all this must be done like right after they give birth, right? Not like 2 years later.
Normally normally it's like within 6 months to 12 months,
birth.
that would be the best.
Okay.
But after 6 weeks, it can be done. The earlier they do it, the better it is. And then when they get back in shape, it's better as well.
Is there any difference for like natural birth or C-sec? Which one?
Actually, there's no difference, but because for natural birth, right, because of the, we actually have a relaxing hormones, which is called the relaxin. So for natural birth, normally the pelvic bone will get wider. Correct. So it will be better if they can actually do the slimming treatment earlier also.
So how do you bring the pelvic closer, smaller? Like what do you
Because
do?
normally it's like involved with those ligaments and then muscles and tendons also. So we will use the machines, and then we will actually use the hands-on technique, to actually to get back in shape.
But like, how many sessions do you need before you?
Ideally, 1 session. Normally, the mothers can actually see the results.
Wow.
But recommended will be maybe a couple of sessions for them to see much more significant results from there.
So what happened to like, what happened to like, for example, if you're a mother for a few years really, can you still get that done to like, make your
my hips
pelvis
smaller?
Yes, definitely it can be done, because even if let's say right now we are doing this cross leg, right, we could even have an uneven hip or even have a high hip also.
Esther.
So, and sometimes due to our sitting posture, like when we cross the legs, right, so we actually have a widened hip, which is the false hip. So you can actually see like some mothers, right, they actually have this shape, the pear shape.
Yeah.
So this can be done also.
Is this general science or is this just for women or for men also?
I think it's
for men also.
It's science, because when you sit like that, right, your whole alignment is off.
Yeah.
My chiro also tells us.
I'm constantly sitting like that.
Yeah.
Correct.
Chiro also say must sit like that.
Physiotherapists also
Cross,
tell you.
you sit cross leg on the floor also can.
Yeah.
Because you widen this
uneven.
the hip bone.
You see the Japanese all like sit like
And then your back also will hurt. Cause not balanced.
uneven.
Correct.
So what's the key difference between like Mumsrelle and like traditional postnatal treatments?
Traditional postnatal treatments, normally they will actually do it, after they give birth. So usually the masseuse, they will travel up all the way to their place. Okay, but however, some parents, some mothers, right, they normally the muscles let's say it's separations, they will actually close the gap by itself. But however, not all mothers do that. So some, they will still leave a gap. So normally for that, then they will come down to the treatments. Then we will so-called to work on their abdominal separation if there is, and then to work on the pelvic misalignment.
What's the abdominal?
Diastasis recti.
Correct.
So the
Separation.
the abs like separate.
Separate. Your muscles basically grow apart with the growth of
And then there's like a gap
So
in
you
between.
put it back.
Correct, because the baby grows back, correct? So separations, correct? So when it expanded, it stretched already. So there's these two vertical muscles, it gets stretched. So sometimes normally it will go back in place, but it don't happen to everybody also. So when it doesn't go back in place, this is the time where they have to seek professional help, that they have to come down the Mumsrelle, then we will use the machine, we'll use the treatments to actually to so-called to close back the gap for them.
But only the machine will be able to do that.
The machines and the hands-on
I
techniques.
see.
Correct.
What happens if they just leave it?
If they just leave it, then
Your
it will
body
be
will be like-
separated. So somehow it could actually cause like urinary incontinence, or it could actually cause backache. Yeah. And then a lot of discomfort can happen.
Oh, I just thought that your abs would look weird. Like,
I know of surgeons who like stitch back one.
3 and 3.
I think
That's the most invasive.
correct, because some we actually have like those mothers, right? Some they have even up to 5 cm or 5 fingers wide apart. Correct. So when we actually check for them, right? I mean, when we actually check for them, you mean the whole finger you can actually go in.
oh,
Because this is normally in the event that when the baby is very big, or maybe when they are having twins.
You mean just by touching you guys can tell?
Can, because
Can you
the
check for me?
muscles, this is called the rectus abdominis, the muscles, the vertical muscles. So if your baby is big, definitely
Me
it will
too.
stretch bigger. So when it stretch bigger, so after you give birth, right? I mean, it's already been stretched. So when we did on my mother's, actually she has more than that, 5 fingers.
wait, did any of you all do this? No, right?
No, I
Can you
didn't.
check? Can you check? Can you press for
Mine,
that?
you can't even get to my muscle because it's all fat. Sorry.
So what if they don't? Wait. So I think for the education of the viewers, right? How do they
you know?
Yeah.
You have it.
Yeah.
Normally for mothers, right, some gynaes, they actually do provide a check after they give birth. But however, our clients, not all gynaes do that also. So when they come to the centers, our therapists, they are all experienced, then they will actually check on the mothers for them. They'll check on the mummies. So we'll let them feel also lah, because after we check, then we'll ask the mummies to actually put their hands, then they can actually feel the
So
separations
there's
around
no
the
symptoms. If you don't know, there's no obvious.
There's no symptoms.
I need
but
to check.
if you
How?
if you don't close it back, right, so you will have a tummy over here.
Oh my god.
Oh my god!
Ah,
That's me!
that's me
Like
too.
that.
Wait. What do you mean by a tummy over there? Your tummy goes to the side?
No lah, the pouch.
The
The pouch.
pouch.
Correct.
Which I have.
Yeah,
Why,
but you
sia?
have to check, but not everybody. Not everybody.
Stop.
Can you
No,
check
she said you
mine?
have tummy over here. She
No,
did
she's saying here.
You will
here,
have a
here,
tummy lah.
here.
Okay, you have
So I
tummy
thought
one
your
side.
tummy
only.
was.
Mirror lah.
I thought your tummy was sengit.
No.
Because it's separate.
No.
No, it's
Okay,
not. It's
so
not.
let's
It's not
say
saying it.
you check
It's
mine
like
now.
the muscles don't hold your thing back in anymore. So it's like so that's why
It's
you
loose
like that.
lah. I think that's why leh.
Yeah.
So you will have the
Mine is
sagging
under
skin
here.
around. So you will
Oh
have the
my
sagging.
God.
Mine is here. Mine is
Here.
here.
That's me.
So because the muscles, the abdominal muscles, right, that actually helps to protect those intestine also. So literally, if you don't close it back, okay,
Your intestines can
then
poke out.
gradually they will.
So if
down,
let's
then
say
you will
you
protrude
check
out
me now,
already.
right, and it's been 4 years since I had my baby, can we still fix it? Yeah.
It can still be done lah, but it will take a longer time.
Can you press?
How you
Check Esther.
Check everybody.
Wallah, Pisces, she want to touch my fats.
Okay, you inhale, exhale. Yeah, look, have look. You feel?
How many?
About 1.5 fingers.
Small
You try.
lah. You're very small.
You try. You inhale. You try to lift it higher. Inhale. Exhale. A bit only. About 1 finger, 1.5.
Okay.
Does it matter your size? Because she's small, so that's why it's small. Is it?
Normally 1.5 finger or less than that is normal,
Normal
after
lah.
birth. It's normal
Esther
after
confirm
birth.
15 fingers. Hey.
No lah.
bad you.
So,
So I need straighten, is it?
Straighten,
And
then
like
you
pull
lift
your
up.
arms up.
Okay. Then you inhale. Exhale. Okay. Inhale.
oh my God, this is like exercise.
Hers is better. Hers is about 0. What? Close
Ah,
but her abdominal muscle is very strong.
Then why her hip so big?
You so bad. You.
Mine confirm a lot.
Okay, let me check. Okay, just L shape.
Oh, okay.
Inhale.
No, that's
Walao, this one better not.
Inhale. Exhale.
I tell you, fat's too much already. Cannot find.
Inhale. Exhale. So far okay leh. Inhale. Exhale. So far okay. A bit only. Also a bit only. So far okay.
No, we are just fat, babe.
I'm
Why
the
so fat?
one.
Walao.
There is
Then
no
there's no explanation.
Just fat.
Stop blaming the pregnancy,
Oh my
lah,
God.
guys.
It's just fats then.
No, because I think you do work out, right?
Yeah.
That's why I can feel that her abdominal muscle is very strong. Because Esther.
Then like between you guys and like normal, those slimming, like
Slimming center.
yeah, slimming centers and everything. Like, what's the key difference? This is specifically for postnatal, lah.
For us, normally we are so-called very niche. Actually, we'll focus on all mothers and all women's wellness. But mainly we specialize in those postpartum where I think some slimming center, they do not provide these pelvic restoration treatments. But we do.
They're more like PP targeted lah.
Correct.
Okay.
Do you do like, because I've heard of like certain places where they cater to postnatal moms also, or moms who have gave birth to multiple children, and they have like this vaginal tightening treatment. Do you all do that too?
That was aesthetic clinic lah.
Yeah, that is for aesthetic clinics. But we actually do have those like, those pelvic chairs. Pelvic chair that helps to tighten the pelvic floor muscles
Muscle.
after that. Correct.
Pelvic chairs.
Yeah.
So like you
You sit down. No, you just sit down. You
Gang.
sit down, and it's this chair that pulses.
Correct.
like-
Electronic pulses
yeah,
that
like
helps to
EM wave.
stimulate the muscles to contract.
Where
It's like doing
Kegel.
it's like doing Kegels, like
Correct.
3,000 Kegels in like 10 minutes.
how where is the vibration at?
It's okay. I've done it before, like
The
once
chair.
or twice. So it's from the chair, and you sit on it, and you feel like contraction down there.
Does it hurt?
Not really.
Oh, it's like those app machines where they just
Correct, but it's like electronic muscle stimulations that actually work downwards from the chair.
Oh, so exercise your meme lah.
Correct.
Yeah. And I must say it helped though. After my third one, right?
Little
No.
sister.
So after my third one, right, when you know how you can flex your Kegel muscles, and then I felt like it wasn't the same. But then after going through that, I'm like, it feels,
Back to normal.
Yeah, back to normal.
and
It really works.
It's like training lah.
Yeah.
and anybody can do it, like mothers also, like apart outside from mothers, if let's say never give birth, like do
Anybody
Can
can.
also what? Like sometimes people just have
for you.
weaker like muscles there.
Because
Like
also
you can-
as we age also, right? As we age, our muscles will tend to be weaker as well. So it doesn't really have to be mothers. It can be across.
Just women.
Women's.
Yeah.
But guys cannot do that, right?
In fact, guys can.
Really? Then what
are they
does-
training?
Anus.
How are they training
Yeah,
their ass?
what does it help
I
with?
mean, gay people lah.
Which part are they tightening or training?
They have muscles around the area. So some
Which area? Sorry. like which part are you training? I'm very confused.
I'm thinking it's
I'm very confused.
yeah, the ball chair.
Stuff
Or the butt or what?
You know what? Actually,
it can
sounds
help
nice.
to prevent prostate issues also. Yeah.
Oh.
Correct.
Oh. You all lah.
So wait, so is the part between like the balls and the ass, that part that is
The
being
taint,
trained?
The perineum.
Is it?
So called around there lah, but actually mostly we actually targets on mothers lah instead. And then we don't encourage men to come in also. Ours is a woman business.
yeah.
Even for the husband that accompanies them, we don't invite the husband to, you want to sit on the chair? No, don't do that.
Okay.
Like more
No, but
privacy.
if guys do, and then what's the benefit? Same ah.
Prostate law? Prostate health.
Prostate health, then also, yeah.
You try. It can be a good app.
Cannot, man.
But just, for content. Not like daily.
That's a good idea.
Yeah, you
Okay,
can come
so-
down to Mumsrelle and try.
Yeah. No, but what are the benefits of like better prostate?
Which one?
Like for men, right? So if let's say I do it, right, what can I expect? What are the benefits?
I'm not sure actually.
Oh, okay. I go and
we really
you know
do
what, let me do a video. Then I contact you and then I go and do. If let's say like, I don't know, like higher sperm count or whatever, I don't know.
You will cry leh.
Why? Pain man?
Because the guys,
EMS is very
Testicle,
strong one,
the guy's
Very
testicles
strong.
is so sensitive,
Yeah,
right?
yeah.
And then you have contraction there.
Like it's like your muscle spasming. Have you tried EMS
Francis. You knew
at the
Francis.
gym? It can be so strong, right, that your arm will lose control of your arm. And you have to like clench and get it back.
I did EMS on my hamstring.
Yeah, you cannot control your muscle and like
Dio has no idea. Just go.
Contracts.
Just go. Just go. I will watch. I'll
Maybe
be
let
very
him
happy to watch.
try and feel how period cramp is first.
the heel one, right?
Yeah.
Yeah.
Wait, but you guys also do like those who's got breast engorgement and all that. Do you guys do massage for those people as well?
We do have breast treatment for them also.
I
So in the
see.
event that if the mothers they actually have breast engorgement,
Yeah.
then normally they will ask for the treatment itself.
Oh, you guys have that as well.
Correct.
Oh, I see.
What about like laxity? You know, cause after breastfeeding, then like maybe your boobs a bit saggy. Then are you able to help
Yeah,
with
we
that?
are doing the treatment as well, like the firming on the breast part and then engorgement as well. So it's actually stages by stages because when the mother they give birth, normally it's like the engorgement that they will face. Then after maybe couple of months later, then we'll work on them on the firming, correct, firming and toning of the bust area, and we will actually work on the hip as well, like hip, tummy, back. In the event because these are all the fats that
So you take care
accumulate.
step by step all the way. Yeah.
Correct. It's like from 1 to 10.
So how do you all treat like saggy boobs?
Saggy boobs because we still needs the machine also because machine that will actually helps to boost the collagen, so helps to stimulate improve the blood circulation. Then we will do a lot of like so-called the massage techniques. Yes.
Collagen helps with breast from.
Collagen in general
with
helps
all
with
forming.
lifting.
Oh, that's insane. So
So after you breastfeed, usually you will lose a lot of the collagen, right? And so that's why people go for this kind of treatment
So
after they
ideally
breast.
it's after because some mothers they don't breastfeed all the way. Some they only breastfeed for the first 6 months. So which is why we have mothers coming in after 6 months to actually to work on the past.
Oh, then if you are still breastfeeding, cannot do.
It can be done.
Oh,
It can be done.
It's better.
Actually, it's
start
better
there?
because this treatment actually helps to improve the blood circulations. Then actually it helps to increase the blood, the milk flow. So correct.
Blocked stuff.
So it's safe even if you're still breastfeeding to actually start the treatment.
Correct.
I see.
This machine is very safe.
is there like an age limit to all these treatments or any age also can? I mean, of course, people like, I feel like women will stop giving birth at like 50, 60 lah.
Huh?
No
I think before that lah. Right?
50, 60.
50, 60,
Because KK
grandma.
is 40, I can't say 40.
I'm 42.
There are a lot of people, maybe 50 50
50 lah,
Right.
maybe lah. There are people who still give birth at 40
we do
something.
have we're not only targeting at postpartum mothers, we're actually targeting for mothers or for women across all wellness also. So we do have clients that they are 60 plus. Okay, they come in for treatments like facial, slimming.
Okay.
Yeah, or maybe to reduce their butt size or maybe to slim their feet or
And I think as you get older, your boobs get saggier.
correct. So they come in for the toning of the boobs, or maybe for the tummy area.
But it will still work lah. Like there's no age limit type thing lah.
Yes, it will still works. It will still
Okay.
works.
There's definitely results. Is it? Like what are the percentage?
It depends. It varies on individual also. Correct.
So you come to the end of this episode. I hope you guys liked it. If you guys are interested in visiting Mumsrelle, they offer a free body assessment. So if you guys feel like you guys have a certain issue that needs to be addressed, just go to Mumsrelle. They do a free body assessment. And if you guys plan to do a treatment, what do we have, guys?
Promo code.
Yes. So I'll leave the promo code here, and this promo code is valid for 1 month from the launch of this video. Right? Yeah. So if you guys are looking to go inside if you guys are planning to visit Mumsrelle, just use this promo code and then you guys will get a discount. And if you guys have any questions about any of the treatments that they offer, you can just DM them at Mumsrelle on Instagram and they will answer you.
Correct.
Yes. So thank you so much, Hazel, for sharing with us all your treatments and what Mumsrelle does. And if you guys have anything you'd like us to talk about, anyone you want us to invite, let us know in the comment section below. If not, we'll see you guys in the next episode.
Bye.
Bye.